watching Louisiana Living with Ashley Dowdy on Fox 14.
And welcome back. It's my pleasure to have Dr. John Ledbetter with Louisiana Pain Care to tell us about how to get relief from chronic pain. And we're talking about interventional pain management today. Thank you, Dr. Ledbetter, for joining us.
Thanks for having me.
What is interventional pain management?
Interventional pain management is a subspecialty of anesthesiology. It is the practice, it's really a clinical practice where we evaluate and treat patients that have chronic pain problems and some acute pain problems such as herniated discs. It is a subspecialty of anesthesiology. It's a board-certified subspecialty. The American Board of Anesthesiology actually certifies us and declares that we are experts. The reason that anesthesiologists make up the majority of interventional pain specialists is because we have extensive training and expertise in spinal injections, which is a big part of pain management.
How did you decide on the specialty?
Well, in some ways, the specialty decided on me. I am a board-certified anesthesiologist, and I'm from Monroe, did training in Texas, and then when we came back to Monroe in the 80s, and I went to work as an anesthesiologist and worked at all the hospitals and did the typical anesthesiologist things. I did labor epidurals and put people to sleep for surgery, and everything was going along fine until one day I got a phone call. I was summoned to the office of the CEO of St. Francis at the time, and he said, "You know what, I think we need a pain management clinic here in town. Would you be interested in doing it?" And I had recognized a need for it, and though I loved what I was doing with anesthesia, I said, look, I'll do it, but I feel like I need to do it right, and that would mean that I need to go back and do a fellowship in pain management and also get board certified. And so I actually did that. I packed up my young family, including a 2-month-old baby, and took them all to San Antonio and went to University of Texas and got that done, came back and opened our clinic. At the time, we had one doctor, myself, we had one nurse, and we had one secretary. And 21 years later, the good Lord's blessed us, and we have grown to meet a lot of needs, but we now have 4 doctors, 7 nurse practitioners, and about 70 employees. So I think there was a need, and we have been blessed to be able to take care of a lot of people, thousands of people really in this area.
Absolutely. I have seen it grown over the years. And you mentioned the types of pains. You mentioned a bulging disc. What other types of pain does interventional pain management treat? We
definitely the most common thing we treat is spinal pain, and the most common spinal pain is low back pain. So low back and neck pain makes up 75% of what we do. There are other issues, there are other types of pain, other categories of pain, neuropathic pain, and that would include shingles, postherpetic neuralgia, RSD, diabetic neuropathy. We treat myofascial pain. We treat cancer pain. We treat people that have had 1 or 2 or 3 back surgeries and continue to have pain. So we see a lot of that sort of thing.
Can you explain how you change the lives of your patients?
Well, first off, we give them a place to come because when you get right down to it, at any given time, 30% of people in America have back pain, and at the same time, only 5% of people with back pain are surgical candidates. So historically, there's not been a good place for those people to come. Surgeons couldn't do surgery on them. The family doctors a lot of times didn't feel comfortable. So we filled a big gap. One thing we can also do for people it's the first thing we do is try to figure out exactly what the source of their back pain is. So many people are focused on herniated discs. A lot of people have pain that's not herniated discs. Joint pain, muscle pain, nerve roots, spinal stenosis, compression fractures. So we can at least define and explain to that person why they're hurting, and then we can come up with a plan of action to take care of that issue.
Well, Dr. Ledbetter, thank you so much for joining us today. And for more questions, you can contact Dr. Ledbetter at Louisiana Pain Care here in Monroe. And still ahead, we'll tell you about a spiritual journey that's so inspirational, it required 2 books. You're watching Louisiana Living on Fox 14.
Right now, it's